everyone. Welcome to a new episode of the English Language Education in Quebec podcast that features thoughtful conversations and a variety of perspectives and voices from the field of English language minority education in the province. My name is Lina Shumarova. I am a research associate with the Quebec English-Speaking Communities Research Network, or QUESCREN, which produces this podcast. We are based at Concordia University in Montreal. Today on the podcast, I have two guests, Vera Granikov and Marlene Chen, who will tell us more about the research project in the area of critical health literacy in the context of lifelong learning. It is my pleasure to introduce them both. Vera Granikov is a Fonds de Recherche de Québec postdoctoral research fellow with the Canada Research Chair in Partnership with Patients and Communities, which is co-directed by Dr. Antoine Boivin and the patient partner Ghislaine Rouly. She holds a PhD in information science from McGill University. Vera has 17 years as experience in health information, patient-oriented and participatory research. As a researcher, information specialist, and community member, Vera is passionate about improving health literacy through working together and learning from each other. Marlene Chen is an independent scholar and community representative for Engage Center for Research on Aging at Concordia University. With Eric Craven and Julian Hanna, she hosted manifesto writing workshops in 2022 on the theme of reimagining the future of aging. She is an editorial board member for Concordia's Aging in Data and Applied AI Who Am AI book club, and is a long-standing member of the McGill University Community for Lifelong Learning. Welcome to you both. It is a pleasure for me to speak with you today. And Vera, I will start with you. What is critical health literacy?
Okay, well, first of all, thank you for having us, for inviting us today. I would say, well, like many things in research, there are often several definitions for the same concept. So before I talk about critical health literacy in general refers to our skills and our ability to look for health information, to understand it, to think about it critically, and also to be able to use it. So, for example, finding information so then I could better manage a chronic condition that I have. Critical health literacy is, it's a more nuanced concept that refers both to being critical, kind of the focus is on being critical about health information, but it's also being kind of more critical about the health system in general and our role in it. So it moves away from health literacy skills being our individual skills and our individual responsibility to a group or collective responsibility. So we need to take into account the role of our context, our cultural communities, the networks that we're a part of, and also our health organizations. So in a way, it shares the responsibility, expands that, yes, health literacy, it's how we understand our health and navigate our system, but it's also what the system does or doesn't do to help us understand what's going on and communicate with health professionals, for example, and navigate the system. And also what I would like to add that health literacy, usually we will say that lower levels of health literacy are found more in groups that are marginalized or disadvantaged in some way. So, for example, migrants or immigrants or people with lower levels of education. But at the same time, it is important to remember that health literacy, kind of for all of us, it is something that can vary. So even when we're in a stressful situation, even if we have all the degrees and even work in the health system and know how it works, in a stressful situation, our own health literacy could go down just because we're really anxious.
Yeah, and as you're saying, critical health literacy is a responsibility of us all, is a common responsibility. And what is the current state of critical health literacy among English-speaking communities in Quebec?
Well, yeah, really good question, because it's very difficult to answer. So again, as I said, that critical health literacy is really, it's like a nuanced concept of this larger umbrella concept. So it's rarely measured. So there are no numbers for critical health literacy. And even the general health literacy, also because it's a concept that keeps changing. So for example, even now that so much depends on using technology. For example, we can't just go and get a blood test at the hospital, that you have to go through the online platform. So as everything changes, the skills that are required to navigate and take care of our health have to adapt as well. So all this to say that it is very difficult to measure health literacy. There are different tools that exist, but there's also a consensus that there's no tool that is really optimal. And I could not find, it's true, all this different levels for me to tell you that I do not have a good answer to your question. I could not find numbers that are specific to the English-speaking community in Quebec, for Quebec in general. And there's a study from 2012. Also, once again, there is a problem because we do not have more current numbers. In 2012, the study showed that 2 out of 3 Quebecers had trouble searching for, understanding, and using health information to take care of their health.
From all languages.
Yeah.
Mm-hmm. So that's possibly, maybe we're identifying a possible area for future research.
Perfect.
We will turn now more specifically to the research project that both of you are part of and that Vera, you initiated. It is called Learning Together to Think Critically About Health Information. And as part of that research, Vera, you approached the Digital Literacy Project at the Atwater Library in Montreal to become partners in the study. And that is how you met Marlene, who was part of that group. So Vera, tell us how your research project began, and also how did your collaboration with the Digital Literacy Project come about?
Okay, perfect. Thank you. So, it started, I would say this was after I finished my PhD, which was about collaboration and information sharing. And in a way, writing the protocol for my postdoc project was, Marlene will smile, that it was really like a braid that I had the opportunity to put together 3 things that were really important to me, that are health literacy and community engagement and collaborative learning. This idea that we could learn together and from each other. And as I usually say, that nobody knows everything, but everyone knows something. So creating opportunities where we can come together and learn from each other. The Atwater Library, I don't know if your listeners know, but it's a very special place that is an independent public library in Montreal that actually predates McGill University. And they had from the very beginning, they would have these educational activities. So yes, there's a library, but they always had this interest in public education. And I volunteered there when I was doing my master's degree in library science a long time ago. And then I maintained a connection with them. And during the pandemic, I was invited to give a talk because our team, at the time I was at McGill at the Department of Family Medicine, and we created a website specifically to help people search for health information, think about it critically, and then also how they could potentially use it, whether, when they go to the hospital or when they have an appointment with their doctor. So I was invited to talk about that resource. So that kind of refreshed, I would say, my connection with the Atwater Library. So when I was done with my PhD and I got the funding for my postdoctoral project, I reached out to them because I knew that there was this interest in collaborative learning specifically. And there was this group or this activity that is called the Peer Café, which is very much learning together about and building digital literacy. And that's where I met Marlene.
Marlene, what motivated you to be part of the Peer Café and then also join the Health Literacy Project?
As mentioned, I was already part of the Pure Cafe and attending pretty regularly at that time that Vera approached us to become involved in her research. The pandemic drove us to work exclusively online, like at the Pure Cafe. It's only online, it's not in person, and we've continued to meet online. It was useful to hear about other people's projects, problems, and ideas related specifically to technology, but difficult to establish relationships. And about motivation, that's a bit more difficult. This might be a bit of a long answer. As I think about it, I'm not sure of the words to describe my motivation per se, but I'm going to say self-preservation and uncertainty for the future. Also, a large dose of curiosity and hope for change motivated me. I find that as an older person, I'm rarely, if ever, asked about my future as though I had one. I'm learning to live with the unknowing and uncertainty where the future is concerned. I say self-preservation because the pandemic preceded the opportunity to work collaboratively in a caring relationship with Vera within community. My health was severely compromised during the COVID, and during the pandemic as a whole, and I learned how to take initiative on my own behalf by participating in her research project. It continues to be empowering.
Wonderful. Yeah, you found the supportive community.
Yes.
Yeah. And Vera, why did you want to have English-speaking participants as part of the project?
Well, and I think we'll probably touch upon this later. The approach, my research approach is participatory. So it's very much to engage with community groups or groups of any kind and see what resonates with them and how they would like to work with. So because I had this connection with the Atwater Library, when I knew that there was this group that is already doing collaborative learning, and I suspected that if I propose to have the same kinds of activities, but about health, it would resonate with them. Usually health is something that resonates with all of us as it touches us all. Sure. So that's how I ended up, with having this group that was Anglophone. It was mostly, I would say, like senior citizens in the Pure Cafe who participate. Right. And then, I was really lucky, and to quote my PhD supervisor, Pierre Pluy, who would always say that science is comparison. So I actually had two groups. I had the English-speaking group online at the Atwater Library, and then I was able to have another group that was Francophone, and that was in person. So that really made my project, I would say, like a lot richer, and to see what the two groups had in common and what was different.
Yeah, and you might be able to draw some of those conclusions and, as part of the findings from your project.
Yeah.
As both of you are speaking about the project, you're describing it as community-based, participatory research. What does this methodology mean in practice?
Oh, yeah, excellent question. Fundamentally, participatory research is about doing research with people rather than on people. So the participants are much closer to being co-researchers rather than in research subjects. And what this means that we make certain decisions together. So, for example, in our project, even though, yes, I had my funding and I had a protocol that described the general idea of what I wanted to do, but some of the details were not decided on. So, for example, it was as a group that we had conversations, but what were we going to talk about? Like, what is interesting to us as a group when it comes to health and health information? What are the different challenges we face together? And it also affected some of the questions related to the research methods. So for example, initially I thought we could do focus groups and then I could do follow-up interviews with participants. But then just the way the group worked, the meetings were online, and the traditions or the rules of the group that were already established, so for example, people could come and go as they wished, or people could open their cameras or not. they could participate or not. And in a way, so if I would come and impose and say, we're doing a focus group, everybody would be forced to speak and potentially open their camera. And I didn't want to disrupt the way the learning was already happening. So in a way, so we had conversations together with the group, what do we do? So at the end, it was mostly like I observed what happened in the groups, and then people were invited to interviews, but there was no obligation, obviously, to participate. But we had, and I remember we had one meeting where actually one of the participants was saying, well, like, you should really record because that would help you so much in your analysis. But it wasn't part of the culture, nothing was ever recorded. So it was it's like making decisions together. Okay. And I would also say for me, kind of on a more, I guess, personal level, that it comes as a researcher, I approach people not as someone who has all the answers. So it's my positionality is different, but it's really coming from with curiosity and a sense of humility. That I am coming and we will discover things together. Mm-hmm. Wonderful. So it's a big privilege and a lot of fun to do research this way.
For sure, absolutely.
Maybe I could just say
absolutely.
Something there that Vera was offering an opportunity to participate in the Community Health Literacy Research Project based on our knowledge and experience with the healthcare system as older adults, not specifically the technology, as we were involved in the peer group cafe. We understood that it was part of her postdoc and that there was at least one other group. There would be consent form, and the role of the ethics review board was explained. I was asked to be involved in other research, but this appealed to me because it seemed to be more open to our participation in the design, although she already had her program and grant money approved.
Yeah, and Marlene, Vera describes your role as more than a participant, but as also a co-researcher. So I'm curious to know, how did that transition happen, and what was it like for you to step into that role?
Oh, that's a good question. I think that Vera has just described the methodology very well. She established trust by joining the Peer Cafe and seeking our help in developing a program of activities for ourselves. Up until then, I was often participating in research projects where I was a research subject, and it felt extractive. I consider myself an independent scholar and did a second master's degree after retirement at the University of London in the UK, graduating fairly recently in 2016.
Well, congratulations.
I had also moderated several study groups as part of the McGill Community for Lifelong Learning and been on their administrative council as chair of the development committee. I guess you could say that I was looking for a meaningful role to play after retirement from my job in the federal government. It was a fit for me. I was looking for my niche. Vera was offering any of us who wanted to co-author or participate more fully in the research, and I took up the challenge. It was important to me to feel that I had agency,
Absolutely, yes, yeah. I was just going to say that this model, this kind of methodology really gives agency to the participants, yeah. Another concept that you both used to describe the project is collaborative learning, and I wanted to ask you, how did collaborative learning shape the process?
Mm-hmm. Oh, yeah, thank you. So maybe I'll start, and then Marlene will talk more about what it felt like to be inside these conversations. So yeah, the idea was, and it is very much coherent with the principle of participatory research, that nobody has all the answers, so it was to create a space where we could bring our questions and say, I don't know, together. And then someone, share experiences to see how we can answer or face these challenges. And yeah, I remember another participant used to say, I'm not here to share my knowledge, I'm here to share my ignorance. But it was really just to say that it was to be able to say, I don't know. So what it meant that we met online we would have about 14 participants on average per session. We met about once a month. In 9 months, we had 10 meetings on different topics that were decided together. So for example, one of the issues that came up was nutrition, that actually, like, for me was a little bit of a surprise, but then it made so much sense, just it being an area where, going back to the concept of agency, that I think especially in our health system, where we may not have agency whether we have a family doctor or not, but we can decide what we eat, and also, well, like, nutrition is an area where there's a lot of misinformation and disinformation. So yeah, the topics really came from the participants. And then Marlene, you can tell us more.
Yeah, maybe tell us how the group meetings, what were they like, the group meetings as part of the project, and give us a sense of the discussions and how learning happened in that setting.
Sure. We started out by exploring what health literacy is, what the challenges we experience related to it, and also what the possible solutions may be. That's a bit harder, but we had 2 activities that were more practical. For example, Vera shared the potential red flags, I would say, that we should have when looking for health information online. People then shared questions, and we searched online together while Vera shared her screen, and we looked for those red flags. We also had guests, like a librarian from the MUHC library talking about their services, a patient partner talking about patient rights, dementia care, grief, and MAID. That was a very interesting discussion about medical assistance in dying, as well as a family doctor who talked about his perspective of care. We even watched a movie and listened to a podcast and talked about them afterward. I'd say it has brought me such joy, self-fulfillment, and allowed space for recovery, reflection, and learning. And I must say it has included, as Vera has said, much laughter and a feeling of camaraderie, because participants interjected with their own life experience in healing and coping, as well as their personal anecdotes.
It sounds like a very empowering experience. Yeah. And you also combined health literacy with digital literacy.
Well, in a way, yeah, and I feel like more and more we can't look at them separately anymore. Right. And maybe if I could just add to what I was really touched just by how much the participants actually shared, and especially when we had, really difficult or conversations about very difficult subjects. Well, first of all, the people who had their cameras, you could really see that they were moved. But also people really shared their personal experiences and feelings, about topics like dementia or grieving.
They felt safe to do so, in that space.
So that, I think we did well to create a space where people felt that they could really talk.
I want to delve now a little deeper into the research partnership that you have established. When we spoke before the interview, you both mentioned the concept of relational accountability. So I wanted to ask you, what does this concept mean, and why was it important for this project? Maybe Vera, you can maybe start.
Perfect. Well, and I'll start a little bit how this concept emerged for us. And it was really, as Marlene was saying, that we talked about ethics, or research ethics, and having approval together. And at this point, so just a little bit how the project progressed, that there were these digital literacy peer cafe meetings, and I would just come to them. So for a long time before the health literacy project started as its own entity, I would come to the peer cafe meetings and just listen, and I would talk a little bit about, what I was thinking and what we could do together. But I was really there as a participant. And to me, it was really important to take this time to build trust. And so people got to know me better. And it's true, a really funny anecdote that happened with this, that at some point, somewhere into the first year, I get an email from my postdoctoral supervisor. And the title of the email just says, I spent the first year drinking tea. And I just read that and I thought, like he is onto me. Because literally I've just been going to the Peer Cafe and getting to know people. And it's been almost a year. So it actually comes from an article about researchers in geography who were doing research with Indigenous communities. And it's also, there's an anecdote where one of the authors goes to her boss and she just says, like, he has no idea that I spent the conversation is about why you don't have articles yet or you have nothing to show. And she's like, I spent the first year drinking tea. So all this to say that I felt like I took all this time to build a relationship of trust that was really important to me. And we had all these conversations about what the project could look like. You know, what are we going to talk about? Is it going to be during the Peer Cafe, outside of the Peer Cafe? What research methods we're going to use to collect data? So we had enough information for me to submit a protocol to the ethics review board of my institution, which is a hospital. So they're used to very different types of research, you know, that is more clinical and may involve, you know, like tissue samples or blood samples. Right. So then I ended up with this 11-page consent form that was, like, even to me, you know, like as a researcher, kind of terrifying as a person. But it was also really scary because I thought that just having this document could threaten the trust and the relationships that I built with this group as a person. You know, but because we're following a participatory approach, so I suggested we have a meeting just to talk about the consent form. And also the way the consent form is structured, that there are certain sections that are untouchable because they're legal clauses, but some of them were open. You know, we could edit the text. So we met together and we talked about, well, like, what can we change? And how could we make this document reflect more who we are and what we want to do? You know, and it really struck me because one of the sections, because as a researcher, we can't guarantee any outcomes, you know, like we can't guarantee benefits. So yes, we say it's low risk, but we're also not promising anything. That's how that form is usually written. Mm-hmm. And the participants said, well, but then why are we doing this? Like, it's really important to us to say, like, what we may gain from this. That is not, I think the sentence that is there is like, this will be a contribution to science, you know, and people said, but what's in it for us? Like, you know, they wanted to see, which made total sense. So all this to say that we worked through the consent form, we made it our own as much as we could, which then unfortunately was not approved by the review board. Mm. So or at least I felt that we needed to have another path forward, you know, but that would be true to the relationships and everything else that we built up till that point. And that's when I came across this book that's called Research is Ceremony by Sean Wilson, that talks about Indigenous research methodologies and this concept of relational accountability. Mm. So then I kind of really attached myself to that and ended up writing it felt like my personal ethical manifesto, but just to say who I am as a researcher and how I'm engaging with this particular group that would go in parallel to the institutional consent form that, of course, I had to use, and I wanted to use. Mm-hmm, mm-hmm. But it was a document that helped me articulate my engagement towards the group as a researcher. And then Marlene will tell you more about the actual concept.
It was a lot of tea drinking, I could say, metaphorically, but I clearly remember the time, place, and setting when I first heard about the principles and values of respect, reciprocity, and responsibility, which are such an integral part of relationality and relational accountability. It was on the evening of September 21st, 2023, at Concordia's University's, it's called University of the Streets Café, you may know it.
Yes.
In French, it's l'Université Autrement, dans les cafés. And they held a bilingual community conversation at Galerie La Guilde in Montreal, and it was entitled, Let's Talk About Decolonization. How do we build true relationships? So it was very interesting to me at the time, and the co-authors of the Community Engagement Guide for Non-Indigenous People, it was called The Women and I can say this easily usually, The Women My Relations. The word is in Cree. They announced the online and in-person launch of the guide, which was to be in days beyond this date, but it was called, their whole session on the launch was called, How Can Higher Education Institutions Decolonize Engagement with Indigenous Communities? During the question period, we learned that Sean Wilson, who Vera spoke about, had a major influence on the development and design of the guide. I didn't know that she had read this book or was interested in this books, but it just so happened that she was very familiar with the work of Sean Wilson and the publication of his PhD thesis, which I recommend to everybody. It's called Research is Ceremony, as it relates to the concept of relational accountability. I attended the launch and many of the workshops held about the guide, and they have had a huge impact on my writing, thinking, research, and work together with Vera.
Very interesting. What, in your view, and based on what you were just saying, how would you describe a meaningful research community partnership?
Oh, yeah, thank you for this question. And it's, there are a lot of articles that talk about community engagement and that will often say you need to develop meaningful relationships or meaningful partnerships. And in a way, until I discovered this concept of relational accountability, I would read and go, but what is it? What makes a partnership meaningful, or how do we know that it's meaningful? And I feel that relational accountability it is the answer, and it is both the process and the outcome. And it's really just being accountable to each other as we work together. When, as Marlene mentioned, some of the words is meaning with respect, with reciprocity, recognition, recognizing each other and ourselves, and positionality. Mm-hmm. So I would say when we're accountable to each other in how we work, no matter what we do, that's where meaning will come from.
Mm-hmm. Yeah, and openness and trust.
Mm-hmm.
Yeah. Mm-hmm.
And the number one value and principle is listening. Mm-hmm. That was a huge part of it. Listening, just stopping to hear what other people were actually saying before you opened your mouth and answered. And for me, it's about how we show up for each other.
Marlene, how did being involved in this project influence how you think about health information or research more broadly?
Oh, goodness, that's another question. It made me understand that I had to participate actively in my own healthcare outcomes. I was playing the role of victim in a healthcare system that is ageist and broken. All of our experiences, participants, in fact, were similar in that regard. Doctors were prescribing medication or referring you to a specialist, and that is all that I was actually using them for. We have about 20 minutes with a doctor, and you come with a specific complaint, but our overall health and well-being, including mental health, is not properly taken into account. For example, nutrition was something we found anyway, doctors are not trained in. Maybe there are some, but in the group, nobody was getting any information about nutrition. And I was seeing a nephrologist at the time due to a poor functioning kidney for about 14 years. And not only did they never investigate my second kidney that didn't show up on the MRI, but they also never told me about available resources like the Kidney Foundation, where food and nutrition are a primary concern in living with kidney disease. On the advice of Vera and others in the group, I now maintain a binder or a history of important documents and notes so that I'm prepared for any future medical appointments, whether it be with the physio or other therapy like osteotherapy, and use them to formulate questions to facilitate encounters with medical professionals and practitioners. I find that I rely on and trust my own body and feelings more.
Very interesting. And it sounds like, as we were saying, it's been an experience that's empowering, but also there are some practical implications to it. You've received practical advice and practical tips on how to approach it in your communication with your doctor. Yeah. Vera, what are some key insights or findings from the project so far?
Well, and it ties nicely with what Marlene was saying. I would say my biggest observation that in the very beginning, the activity that we did was called a problem tree, which is really you draw a tree and you think about what are the challenges or the problems related to health literacy, what are the root causes, and also what are the potential consequences. And it's very much, we started in this, what I call like a deficit-based perspective, so it was very much how the health system is broken or what the health system is not doing, what the health system needs to do, how it needs to change. And it was all, I guess, less agent. It wasn't about what we can do, but what the system needs to do better. And then I would say at the end, it was very much strength-based or asset-based, and just to see, yes, the system that is all true. Our system definitely is not functioning optimally right now. But what are the things that we do have access to? What are the resources that we do have? So it's really this shift in perspective that was really striking to me. And this value of small steps, so like Marlene was saying that, for example, we could keep really good notes about our symptoms, about, the appointments that we have with our health professionals. We could go more often and talk to our pharmacist, who also has a lot of information. So it was really focusing on what we can do and what are the small things that can make a big difference. And I would say that there's also just a shared sense that having these conversations and learning together was a really enriching experience. And we got different things out of it, but that yet people found value in that.
Yeah, absolutely.
I guess because systemic change is so daunting, really. What can you do? And then, but we found meaning and what we could do from a personal place.
Yeah.
What is next for the project? Are you planning to continue the research? And how do you hope to share the findings with others?
Okay, thank you. So and as you're aware how research funding works, so the fellowship that I had was initially for 2 years to do the research project. And that is over now. So the activities with Atwater Library came to an end. And I need to finish my analysis and to do the writing of the article that I hope Marlene will participate in. And also, so now I have the funding, it's an extension to my postdoctoral fellowship that is specifically for knowledge mobilization. So the idea is to go and do workshops and outreach activities, even like the one today, both with the public or in the community, but also with community organizations that may be able to organize their own co-learning groups. So it's really, I guess, we're in knowledge mobilization. And then also our main project made shoots of new projects that Marlene will tell us about.
Sure. One of the things that is ongoing is our exploration of relational accountability and our writing project using what's called the essay in two voices approach. I don't know if people are familiar with that, but we will elaborate on this in the blog post that we're planning as a companion piece to this podcast. Secondly, this has led us to work on a collaborative autoethnography paper together. Thirdly, I was inspired by our writing using the essay in two voices approach and participated recently with Molly Claire Gillett in the ENIS NANIS, that stands for European Network of Aging Studies, and the North American Network of Aging Studies conference. It was a joint conference held in Lleida, Spain in April, based on a work in progress about writing manifestos that we've been referring to manifestos a lot during this project. And the theme was reimagining the future of aging. So that's something that's keeping me busy. And then in addition, Vera and I submitted a proposal for a workshop to the CAGE 2025, which is CAG 2025, that represents the Canadian Association on Gerontology, which will be held in October. Montreal will host this conference through Concordia's Engage Centre for Research on Aging. The theme is Radical Relationality and Aging, Creativity, Community, and Connection. So that's something we've decided to get involved in. Our abstract is being considered right now.
Mm-hmm. Amazing. So you have a lot of projects planned. And we'll make sure to keep an eye out and shoots, of the main project, exactly. So we'll make sure to keep an eye out on your next steps.
Oh, yeah, thank you.
And so Vera, Marlene, it's been wonderful to talk with you today and to hear your experiences, your perspectives on collaborative learning, on relational accountability, and on critical health literacy. Thank you so much for being here, and best wishes for the next steps in the project.
Thank you.
Thank you.
This was an episode of the English Language Education in Quebec podcast, produced by QUESCREN through its initiative, the ILET Research Hub. Funding for this episode was provided by the Secrétariat aux relations avec les Québécois d'expression anglaise. QUESCREN also receives funding from the Department of Canadian Heritage and Concordia University. Our sound engineer and editor for this podcast episode is James Ford. Original music is by Christian Graham. I'm Lena Shumarova. Thank you for listening, and I hope you will tune in again for our next episode. Goodbye.